But we will begin with the coronavirus this morning as the death toll in the U.S. continues to grow by the hundreds every day. Right now, there are nearly 118,000 confirmed deaths. Infection rates and hospitalizations are rising in numerous states as businesses open up. Meanwhile, the new hotspots continue to emerge in states across the South and Southwest. Officials in Arizona, Florida, and Texas are all reporting their largest ever single-day increases in new cases. The new daily highs come as all three states moved swiftly to ease social distancing restrictions and allow more businesses to reopen. According to the New York Times database, there were among 20 states that have seen the number of newly reported cases grow over the last 2 weeks. The Times reports that even taking into account the increase in testing, the rise in confirmed cases in several Sunbelt states suggest increased transmissions, and they pointed to other measures, including the percentage of positive tests and hospitalizations. Yesterday in Florida, health officials reported nearly 2,800 new COVID-19 cases. That is a record high for a single day since the start of the pandemic. Arizona reported nearly 2,400 new cases as hospitalizations there reached an all-time high. Right now, over 80% of hospital beds in that state are occupied. And Texas reported just over 2,600 new cases and reached a second record high for hospitalizations. So there you go. Willie?
Meanwhile, Mika, a COVID-19 model once used by the White House now projects more than 200,000 Americans could die of COVID-19 by October 1st. The data comes from the Institute for Health Metrics and Evaluation, which estimates death from the pandemic in the U.S. could reach anywhere from 171,000 to 270,000. The prediction went up by more than 30,000 since last week. Based on the model, daily deaths from the pandemic are expected to begin rising again in September after they had begun to plateau nationwide this month for the first time. Joining us now, Dr. Vin Gupta. He's a pulmonologist who has treated critically ill coronavirus patients in Washington state. He's also an NBC News medical contributor. Dr. Gupta, good to have you back with us this morning. So what do you make of this new explosion in cases across the Sun Belt, Texas, Florida, Arizona among them? Some people will point to an availability of testing, letting us know there are more cases. What do you see in these numbers?
Good morning, Willie. The explanation here is straightforward, and Mika just beautifully described it, which is cases are growing out of proportion to testing, meaning we just can't attribute it to testing coming online finally, as the vice president wants to ascribe this to. No, this is the result of people moving around more. We know mobility data suggests people are just engaging more. And that's one of the reasons why. In Arizona, Governor Ducey opened things up about a month ago. In Florida and Texas, as mentioned, they were on the front lines of saying, hey, let's open up to phase one. So that is having a clear consequence here. We also know that masking is just not happening anymore at broad consensus. 1 in 2 Americans, according to an Axios Ipsos poll, say they sometimes wear a mask when they go out in public. That number actually declines if you're a Republican versus if you're a Democrat. So leadership here matters. And then finally, I would say leadership. We don't have enough governors here in those states actually sounding the alarm bells because they're listening to what the president and the vice president say, which is all's well, open up. So that means ICU bed capacity. We don't have enough ICU bed capacities. We're seeing ICUs fill up in Port St. Lucie, Florida, and Tucson. So this is really concerning. We're all concerned.
Well, and doctor, I saw last night a Montgomery Advertiser story talking about a city council meeting where doctors went and passionately argued. They actually argued for a proposed ordinance for mandating face masks in public, and it was rejected. Several doctors and others spoke out at the council meeting, and they were in support of the proposal, but they detailed in the horror stories of the amount of COVID-19 patients that were coming into local Alabama hospitals. Jackson Hospital pulmonologist told the council, quote, "The units are full with critically ill COVID patients. this mask slows that down. 95% protection from something as easy as cloth.
That's incredible.
If this continues the way it's going, we're going to be overrun. According to the Montgomery Advertiser, more doctors followed him to the microphone describing the dead in Montgomery, Alabama being carried out within 30 minutes of each other, and doctors being disturbed when people on the street ask them if the media was lying about the pandemic as part of a political ploy. And of course, the proposal failed. And you're right. This is about leadership. These doctors, these poor doctors and nurses are working and carting out dead people in Montgomery, Alabama, only to have others outside the hospital asking if the coronavirus is a hoax as we approach 120,000 dead Americans.
Joe, you're highlighting such an important issue here, which is us now battling this perception that we're lying, that we're making this all up. And this goes back to that point. We've talked about this on air. Mandatory masks. I've been criticized for going too far, but now we're saying maybe that's where we actually need to be, because people just can't be encouraged to do something for the greater good. So, Joe, we all understand and empathize with those doctors in Montgomery, Alabama. We're worried it's going to happen in our zip codes because it's already happened in places like Seattle. And I'm about to enter a shift in Seattle where the ICUs are already filled. We don't have much capacity. So this is a 5-alarm fire here. And we need the president and the vice president to acknowledge that instead of trying to encourage governors to say, hey, by the way, it's all good. Talk to your citizens about testing being potentially the reason why you're seeing increased cases.
And Mika, let's be very clear. We've been talking on this show for some time about the need to reopen, like to reopen businesses, but to reopen them safely. And I went in this weekend. I ordered takeout for breakfast for Jack and I went over, and they have it. This place has it where you can pick it up outside, and so you don't have to go in and be around people. But you do have to go in, get your drink. Jack wanted an orange juice, so walked in, had my N95 mask on, got it, walked out. And I was really surprised. I went in, and you look, and it was pretty packed in there. Half the people in there had masks, and the other half didn't. And there really wasn't a clear breakdown. You couldn't look at somebody and go, oh, there's a Trumper not wearing a mask. There are a lot of people who I would assume, just from the Trump supporters I know, looked like they probably were going to vote for Donald Trump. There are a lot of people that had masks on. There were a lot of people that didn't look like they were going to vote for Donald Trump who didn't have masks on, if you just break it down by age and demographics and everything else. So there was no rhyme or reason to it. But there is no doubt that a lot of polls show that the more likely you support Donald Trump, the less likely you are to wear masks. I hope that as we move forward, we move beyond that, because I have a lot of friends and loved ones who need to be wearing masks.
But in terms of no rhyme or reason, it is also that people have been in lockdown for months now. They've been socially distancing. Their kids haven't been on school. They're going to look for any opening. I mean, it's just natural to be able to have some semblance of normal. I have a friend who's a real estate agent in an area that's sort of a vacation area, says her phone is ringing off the hook, cannot come up for air. Usually her phone is not ringing, quite frankly. She does a few things here and there, ringing off the hook with people wanting rentals, wanting to get out, wanting to go on vacation. It is about leadership. And if leadership leaves an opening, here you go. But and see, this is deadly.
Here's the thing. Of course people want to get out. Everybody wants to get out, and they should get out, but they should do it safely. And the Wall Street Journal this morning, by the way, has a great has a great piece talking about what we know about how you get coronavirus. You don't get coronavirus. And Doctor, let me go to you here really quickly. What the Wall Street Journal story this morning, very helpful, says this is what we know so far about the coronavirus. You don't get it off of surfaces. You don't get it usually outside as you're passing people, talking to them outside. You get it inside, in closed spaces where there's not a lot of ventilation, where you have longer encounters, face-to-face encounters, where people are talking loudly, or in one famous case, the Wall Street Journal says that choir that was singing, so many people got it. So we're starting to know more about it. You can walk in parks. You can walk on beaches. You can do you can socially distance. You don't have to be wearing masks 24 hours a day. But if you go inside a restaurant to pick something up, for God's sake, wear a mask.
Joe, you highlighted such an important thing here. It's the outdoor component here versus the indoor component. People gathering outdoors, as long as they can maintain social distancing, we're less worried about transmission of COVID-19 because of air and just air dynamics. It's hard to transfer the virus in an outdoor setting. In an indoor setting, that's why we're so worried about the Tulsa rally with President Trump. That is a super spreader event potentially because, well, one, will people wear masks? But two, they're going to be in the same place for over an hour, and we're worried about that. That's exactly right. Indoor transmission is much more likely than outdoors.
I want to ask you before you go about this new treatment, steroid, dexamethasone, if I'm saying it right. How hopeful is that, and how impactful is it in fighting the coronavirus?
You know, Mika, when I saw that headline, we have 8 patients right now in the ICU that are on a steroid. We're hopeful it works. Mm-hmm. And this is encouraging. The headline itself is encouraging. What's not encouraging and what gives us pause is there was a press release instead of a peer-reviewed paper. There's no data. So we don't know. In this era when we talk about hydroxychloroquine on a press release, when Moderna publishes data on a vaccine with just 6 individuals, it was just based on 6 individuals, their phase 1 trial, no data, it gives us pause. So we want to see data, but yes, this initial headline suggests, hey, if it works, fantastic, and we're going to look out for that data.
Dr. Vin Gupta, thank you so much for being on this morning. As we follow this, we'll be having you back, I'm sure.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.